Urinary tract infection, UTI. Female urinary or male urinary system. A urinary tract infection, a UTI, is an infection in any part of the urinary system. The urinary system includes the kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, the bladder, and the urethra. Women are at greater risk of developing a UTI than are men. If an infection is limited to the bladder, it can be painful and annoying. But serious health problems can result if a UTI spreads to the kidneys. Healthcare providers often treat urinary tract infections with antibiotics. You can also take steps to lower the chance of getting a UTI in the first place. Symptoms. UTIs don't always cause symptoms. When they do, they may include a strong urge to urinate that doesn't go away, a burning feeling when urinating, urinating often and passing small amounts of urine, urine that looks cloudy, urine that appears red, bright pink or cola-colored, signs of blood in the urine, strong-smelling urine, pelvic pain, in women, especially in the center of the pelvis and around the area of the pubic bone. In older adults, UTIs may be overlooked or mistaken for other conditions. Types of urinary tract infections. Each type of UTI may result in more specific symptoms. The symptoms depend on which part of the urinary tract is affected. 1. Part of urinary tract affected, kidneys. Signs and symptoms: back or side pain, high fever, shaking, chills, nausea, and vomiting. 2. Part of urinary tract affected, bladder. Signs and symptoms: pelvic pressure, lower belly discomfort, frequent painful urination or blood in urine. 3. Part of urinary tract affected, urethra. Signs and symptoms: burning with urination, discharge. Causes. UTIs typically occur when bacteria enter the urinary tract through the urethra and begin to spread in the bladder. The most common UTIs occur mainly in women and affect the bladder and urethra. Infection of the bladder. This type of UTI is usually caused by Escherichia coli, E. coli. E. coli is a type of bacteria commonly found in the gastrointestinal, GI tract. But sometimes other bacteria are the cause. Infection of the urethra. This type of UTI can happen when GI bacteria spread from the anus to the urethra. Risk factors. UTIs are common in women. Many women experience more than one UTI during their lifetimes. Risk factors for UTIs that are specific to women include the following. Female anatomy. Women have a shorter urethra than men do. As a result, there's less distance for bacteria to travel to reach the bladder. Sexual activity. Being sexually active tends to lead to more UTIs. Having a new sexual partner also increases risk. Certain types of birth control. Using diaphragms for birth control may increase the risk of UTIs. Menopause. After menopause, a decline in circulating estrogen causes changes in the urinary tract. The changes can increase the risk of UTIs. Urinary tract problems. Babies born with problems with their urinary tracts may have trouble urinating, which can cause UTIs. Blockages in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder. Risk of UTIs is higher. A suppressed immune system. Diabetes and other diseases can impair the immune system, the body's defense against germs. This can increase the risk of UTIs. Catheter use. People who can't urinate on their own often must use a tube, called a catheter, to urinate. Using a catheter increases the risk of UTIs. A recent urinary procedure. Urinary surgery or an exam of your urinary tract that involves medical instruments can both increase the risk of developing a UTI. Complications of a UTI may include: when treated promptly and properly, lower urinary tract infections rarely lead to complications. But left untreated, UTIs can cause serious health problems. Repeated infections. Women are especially prone to having repeated infections. Permanent kidney damage from a kidney infection due to an untreated UTI. Delivering a low birth weight or premature infant when a UTI occurs during pregnancy. A narrowed urethra in men from having repeated infections of the urethra. Sepsis, a potentially life-threatening complication of an infection. If the infection travels up the urinary tract to the kidneys. Prevention, these steps may help lower the risk of UTIs. Drink plenty of liquids, especially water. Drinking water helps dilute the urine. Bacteria to be flushed from the urinary tract before an infection can begin. Try cranberry juice. Cranberry juice prevents UTIs aren't final. Drinking cranberry juice is likely not harmful. Wipe from front to back. Do this after urinating and after a bowel movement. It helps prevent the spread of bacteria from the anus to the vagina and urethra. Empty your bladder soon after having sex. Also drink a full glass of water to help flush bacteria. Avoid potentially irritating feminine products. Using them in the genital area can irritate the urethra. These products include deodorant sprays, douches, and powders. Change your birth control method. Diaphragms, unlubricated condoms, or condoms treated with spermic. Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by SHAH provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by SHAH is the perfect resource for anyone looking to improve their overall health and well-being.